Okay, so now we're looking at the two muscles that dorsiflex the wrist and attach to the radial side of the wrist. Now they both attach into the second metacarpal. Both tendons attach into the base of the second metacarpal, and there are two. There's the extensor, carpi, radialis, longus, and brevis, the long and the short muscle. So we'll discuss the brevis first, and this is actually quite an important muscle. This muscle again arises from the common extensor tendon, and it runs like this down the forearm, becomes a tendon about here, as does the other, comes down and joins into the base of the second metacarpal. Now, what's important about this muscle is that this part, the proximal part, actually comes into the lateral epicondyle, and it runs over the head here, directly over the proximal head of the radius. So as you rotate your arm, this tendon tends to become abraded or get wear and tear in it. And the primary cause of tennis elbow, which is lateral elbow pain, is that the tendon of this particular muscle becomes damaged. So recognizing that, we're not talking about trigger points, this is just some wider medicine. The tendon of the extensor carpi radialis brevis is the primary area that becomes damaged with tennis elbow or lateral epicondylitis or lateral epicondylosis. So the test for this is if I can borrow your finger, if you have the arm pronated and then you lift this middle finger, if you lift your middle finger, if as you do that the person goes, ah, and this is where the pain is, this particular test, so it's an extension of the middle finger, will turn the pain on if the tendon is injured. Okay, so and the reason is that, of course, as you lift this finger, its insertion point into the base of the metacarpal is in fact stressed. Okay, now the trigger point again is there, and the trigger point is tends to be in all these muscles, tends to be in the biggest area of muscle bulk, and the trigger point refers down to this part of the wrist and refers up to the lateral. So a lot of you seeing now that there's a lot of referral up into this area, which is such a common area of pain. There is a second, so the extensor carpi radialis longus, it starts in the same point, but it actually runs right across the elbow joint. So coming from here, runs over and joins into this, it's a thin area of the humerus here, and it's a crest, so it's the crest above the epicondyle, the supracondylar crest on the distal humerus. And so if you feel, and you can feel there's a ridge running here, and this attaches to this area of the ridge. So now this muscle runs across both joints, and this comes along like this and runs down and joins into exactly the same place. The trigger point is a bit further over, and the primary place that the longus muscle, the primary area that it refers pain to, is here. A little bit down there, but not as much, mainly up this way. So you can see they're all very close to each other, and a lot refer this way and a lot refer that way.